Yep, here I am again, Len Gurian, welcoming you to an hour of Think, Talk, Laugh Radio. And what we're trying to do is help you people understand what is happening to the health industry today. It's a scary place to be. Changes are apparent every minute. And the people who are in it and dishing out what you need to keep you alive are just about as much confused as you are sometimes.
They are not. Well, some of them may be.
Well, whatever. You got to say something when you open the show, you know. You really have to.
Mark Twain.
But what did he say?
I thought he said something about wanting to live in Cincinnati because they get information last, but I think in healthcare
at the end of the world.
Yes, he wants to be there
10 years later.
The world wants to be here because they'll get the
But in
last.
healthcare, Cincinnati is holding its own, if not becoming a model for things like healthcare, et cetera.
And for that, I'm very glad because it gives us a chance to understand or get a beginning of an understanding of what's happening to the health industry today. And we have in the studio with us today.
I'm Graham Hart.
Who?
Graham Harden.
Really?
Yeah.
It surprised me.
I've been here a while.
And I'm Elsa Abruzzo, and glad to be back. I've taken a little bit of a hiatus.
Way too big of a hiatus.
And my daughter, Viva Gurian, who also produces the show, and sitting in the corner by herself.
No, she's surrounded.
We have a
surrounded by love. I feel it.
You are surrounded by love. A young lady who, by the way, is going to be a big help to your understanding on what you can get as an advocate for you when you're in trouble in the health industry.
Yeah, she's our secret today, and she's going to enlighten us about a lot of things we do not know.
Oh, I need enlightenment. I really need it.
Yeah, we're going to introduce Karen Mueller here in a little bit, and she's going to be with us all segment show long.
Yes, probably 2 through 4, because she's got the information that we all need.
Absolutely. This show, Think, Talk, Laugh, is about navigating the healthcare system. And one of the biggest question marks people have out there is the PPAC, or the Patient Protection and Affordability
Care Act.
All that stuff. The mouthful. That's why I like initials.
Let me tell you something.
That's why I like initials.
That's how complicated it gets. The title is tough.
It is.
And if the title is tough, can you imagine how tough it must be to just get around and know what's going on?
Anything more than 2 syllables, I'm done.
Well, this topic is a huge topic, and it's much more complicated than just one show and a few segments can cover. But we hoped with Karen today to be able to provide a general understanding, and especially what it means to the consumers, what's going to be transparent to them or not transparent to them, because a lot of the stuff, one, we're still trying to understand, and it's changing and it's evolving. And a lot of stuff is going to be through your health employers and through systems that you may not completely be aware of. But then there are going to be some changes that you're going to see or be aware of. And hopefully we can get to those and cover a lot more other stuff in other shows and segments.
Well, mostly I think we're concentrating on what the community of Cincinnati, which is where most of our listeners are from, although iHeartRadio are available worldwide, but what the community of Cincinnati is doing to empower patients or employees or employers to master this Affordable Care Act, and perhaps we'll go into a little bit about pre-existing conditions. So,
and we're going to have lots of questions, which means we know our listeners are going to have lots of questions too.
Yes.
So do not be afraid to call in. Our phone number here in Cincinnati is 749-5500. If you're on the AT&T network, that would be pound 550. And for those of you who are calling long distance, call 800-823-TALK.
Excellent. And I think, I was talking in the green room about how I had a nightmare last night that I ended up doing the show all by myself, that Karen couldn't make it. And everyone's kind of afraid to approach this Affordable Care Act, because who can digest 26, and I get this from the internet, 26 to 2,700 pages of the initial act. And then from what I've heard, every week there's like 1,500 pages of new updates and data, et cetera. So if you're trying to figure out, whether you're an employee or an employer or a hospital or whatever, how to get through this layer, that's a lot to chew on. I mean, I think I could talk clearly about the Gettysburg Address, the Declaration of Independence, the Bill of Rights, because those were manageable amounts of pages. This is a lot of data for anyone to digest, and you need a trusted team. That's all there is.
But isn't it nice to know we have somebody in
I
the
know.
studio today who is going to be an advocate for us and
Absolutely.
take us through this jungle? Karen, say something.
Well, let's properly
no
introduce
pressure,
her then.
huh?
Folks, we have Karen Mueller with HORAN Associates. She is the Executive Vice President there. Karen, tell us a little bit about HORAN Associates and what you folks do and how you have embraced the PPACA.
Well, sure. Just quickly, HORAN has been around since 1948, so we're not new to this area. Always very involved in the community, and a big part of our focus is really to make sure that we are giving back to the community in ways that we can, both personally and professionally. And part of that is in the areas of helping people understand health insurance, helping people plan for retirements, and then helping individuals manage their wealth. So those are some of the key components of the things that we do at HORAN. We're very focused on people.
And hold on, before Karen goes any further, I got this off their website because the three words she said again and again and again are helping, helping, helping. And on their website, HORAN, Terry was awarded Beacon of Light Humanitarian Award for 2013, win Cincinnati Business Courier's Healthiest Employer Award. Karen, who's right here with us, honored with Butler County's United Way Otis Briggs Outstanding Volunteer Award. Valerie Bogan Powers features in Cincinnati Business Courier's Wellness Works article. Girl Scout of Western Ohio distinction for Cheryl Campbell, on and on and on, because this is about community building, which is what Think, Talk, Laugh is about, and it is about helping each other and guiding each other through this thing called navigating the healthcare system. Woo!
That's a lot.
Me too. I feel the same way, Karen. You're ready to do this. Are you ready to lead us to the promised land?
I am going to do my best.
Well, and HORAN Associates also has some really interesting tools from what I've heard. They have a reform impact analysis modeling tool,
Correct.
and they have some videos and other links on their website that can really help us beyond this show and other shows that we're going to do with you guys, hopefully.
Hopefully. Well, I know that as Viva said, one of the things that we see is that the original legislation was about 2,700 pages, and there are 1,500 pages of updates that come out on a weekly basis.
And when I found that out, I really thought it was a typo, that maybe someone slipped and added an extra zero, but that's a lot.
It is a lot, but for us, clarification is a good thing because there are a lot of questions that still need to be answered, and time is really starting to run out. January 1st, 2014 are when a lot of the big changes really start to kick in. But the law was passed on March 23rd of 2010, and we've already started to see the impact of some of the changes that have already started occurring. I mean, one of the big changes is for many of your listeners is probably just the expansion to the dependent age of 26.
Yeah.
And that's really impacted a lot of
Having
people.
a 21-year-old, that helps me.
Yeah, absolutely.
Yeah.
Absolutely. And so, there's small changes that have been occurring, and just clarification. The biggest thing for, employers, maybe let's go back to what your listeners should really be focused on. And I think some of that is just paying attention to, if you're employed, what are your employers doing? They're doing a lot of work behind the scenes to better understand what the law, how it's going to impact their business, and how it's going to impact you as employees.
Well, we have to go
all good information, absolutely. Yeah. And I know where you're going with that, Elsa.
Well, I was going to say I have to go to break, but before when we come back, I really still want to know about the expansion to age 26 because I know about it, but I still don't know how it affects my kid or me or what I need to do and do I need to contact my insurance company? So these are all great,
beautiful,
wonderful
all
things.
Questions we're going to pose, ask, and
it's
answer.
It's all about me. I need to know.
Next segment with Karen Mueller here on Think, Talk, Laugh. 55 KRC, the Talk Station. Welcome back to Think, Talk, Laugh here on 55 KRC, the Talk Station. We're here with Karen Mueller, Executive Vice President at the HORAN Associates, and we're talking the Patient Protection and Affordable Care Act, the PPACA. And knowing we had questions, we already have a caller with a question. We have a caller, Bill from Dayton. Bill, how are you?
I'm fine. Great show.
Thank you. You got a question here with Karen Mueller.
Karen, how will my health care be affected if my doctor combines his practice with a hospital?
Well, that's a great question. And so how will you be impacted personally? Well, one of the things that we've been seeing within the whole industry as a result of healthcare reform, there were about 150 pages of language that was in the original law that talked about accountable care organizations. And this is really the only part of the law that really could change and impact employees and people's health. And with this, what we started to see is that we need to get more information. We need to have better control over our healthcare system. We need to be able to show and demonstrate outcomes. So part of this is through the electronic health information is some technology where we can get all of your healthcare records combined so that physicians have the opportunity to really look at your information regardless of what doctor that you're going to or what hospital system. So that was a big part of the push for a lot of the hospitals actually purchasing many of the physician groups. So what that means is that the hospitals have helped fund some of these practices and getting them up to speed from a technology standpoint. What the desired outcome is there is really to focus on improving your health and improving efficiency. So the more we know about you as an individual and know and understand where you're receiving your care, the better opportunity that we really have to help you improve your health and to manage your health more effectively.
Did that work for you, Bill?
The follow-up question I'd have with that is, does that limit my ability to go to only one hospital?
You will have certainly the opportunity to go to any hospital that you want, depending upon how your health insurance works. But what is really the idea is that to get you into a healthcare delivery system so that the physicians and the doctors within that delivery system are talking to each other and making sure that you're getting the right care at the right place at the right time. So does it limit your ability to go to one system to another? It does not, but what the idea behind it is really to improve efficiency and to help improve your health.
All right. Well, thank you very much. You have a great day.
Appreciate the questions, Bill.
Thank you.
Well, Karen, during the break, we were talking about, and it kind of leads into, from this segment, we were talking about some of the costs associated with, ACA and, who it impacts, and you were mentioning some really interesting statistics to me. Can you share that with our audience?
Well, just a couple of things. In terms of what the Congressional Budget Office was projecting for what the cost of health care reform was going to be just from the federal government standpoint, the cost over the next 10 years is $938 billion for this reform.
Mere bag of tail.
Well, interestingly enough, that's only about 2% of the federal budget. So,
whoever won whoever won Powerball can help out with that, right?
They won the Powerball.
Yeah, one ticket. So we got one source for that. Sorry, I couldn't resist. And for those of you folks out there, once again, if you want to call in, it's 749-5500, pound 550 on the AT&T network, or 800-823-TALK.
Well, Karen, one of the questions that I had, and I think we talked about this in the green room, is, my understanding of health exchanges and also the impact of sequestration, if any, on all this. Can you just give it to us in very general terms and kind of educate us?
And for people like me who didn't even understand what she just said, like sequestration and all that sort of stuff, this will be good.
Well,
boil it down to like a 5th, 6th grade level, especially for Graham.
Absolutely.
No, for me, take it down to a 3rd grade.
I was going to say, for me, we have to take it down to a 3rd grade level. So you talked about healthcare exchange. Really, that is an opportunity for people who have been uninsured to purchase health insurance, or whose employers may have been offering health insurance coverage and decide, we don't want to do this anymore. Because for some small employers, the expense could be pretty hefty. And so there's lots of choices that employers have to make.
Well, how many number of employers? Like, I have a small company. At what point do I have to be offering health care?
Well, at 50 employees is when you have to start. But
I'm
there's
safe.
Well, but here's the thing: everybody who thinks that they're safe may not be safe, because this is where the law gets pretty complicated. We did a seminar a few weeks ago, and it was an hour-long seminar on simply how to count your employees. So we don't want to go there today.
Oh, okay.
Ha. I don't think we have, because we don't have an hour to talk about.
So you can't just count 1, 2.
It would be nice. It would be nice if that's the way it worked, but no, the law is simply not that easy.
Okay,
and
so
that's part of the 1,500 pages that you get.
I think I just had to repeat 5th grade, folks.
Okay, so now, what was this law built to accomplish, really, Karen?
Really, the law was built to what it was built to accomplish was to provide accessible, quality, affordable health care for all Americans.
And is it doing that?
Oh, wow.
Okay, all right. We're back into college level, and I'm talking.
No. I mean, because you mentioned that it was earlier during the break. I'm not trying to put her on the spot. She said that a third of the people might see an impact, a third of the people won't see any impact, and
there's 310 million Americans, and it's projected that there's about a third that will be better off. There's about a third that will be worse off. And there's about a third that probably won't see any significant impact.
So the third that'll be better off, those are people that maybe didn't have insurance before and can get it through these exchanges, or
correct.
And maybe in a later segment we can figure out, well, how do we get in that? Or like, for example, my son who's 21, if he wasn't covered under my plan, which now he can be, right, till 26.
Correct.
How would he go about getting health care? And then the people who aren't going to do better are those folks that were on private insurance through employers, that maybe the employers are dropping them, or is that?
Could be a combination. I mean, because one of the things you said, I'm a small employer. Am I safe?
Mm-hmm.
Well, there's not an easy answer for that. So one of the things that we do at HORAN, we've been working with a lot of our clients to do these, what we call the PPACA, impact analysis.
PPACA.
I've heard it called PPACA, yeah.
PPACA. We got it. Thank you.
Okay, 3rd grade level, right?
Yeah.
Yeah, it's like HIPAA, PPACA.
Well, there's so many acronyms in our business, and so we have a new one now.
IDN, POLs, all these.
But really, what we've tried to figure out there is that there is not one simple answer, and literally every employer and every individual is going to have to do an assessment to figure out how this is going to work for them. And so for the employers, there's a lot of questions that still need to be answered. So what we try to do is to help them figure out what happens and what is the cost impact if I just keep things exactly the way they are today. The second thing, what happens if I decide to drop health insurance? What is the cost impact of doing that? And then the third thing we try to look at is, well, what if I just do the minimum? And what is that? And what is the cost? Because from a budgeting standpoint for employers, this is a pretty big deal. And we see just for the insurance changes that are taking place, we're estimating in 2014 just a cost of about 5 to 7 additional % on top of the healthcare trends that are already out there.
For employers?
For employers.
And so I want to bring it back to Cincinnati, if you don't mind. And I just want to know what changes in our community regarding the delivery of healthcare are occurring.
Well, one of the things we touched on with the last caller was one of the things that we've seen is that a lot of the hospital systems, the delivery systems, which are made up of the hospitals, the physicians, the providers, the outpatient facilities that are around, those delivery systems have made a lot of purchases of physician practices. So there are about 85% in our community of that were previously independent physicians are now part of a hospital delivery system.
85%.
Yeah, that's a pretty big number.
That's amazing.
Yes. And so, again, what I was trying to address was that part of the reasoning for this was to bring some more efficiency to the model. And one of the big drivers and initiatives that we have here in Cincinnati is some dollars that were funded from the federal government called the CPCI, which is the Comprehensive Primary Care Initiative. So dollars that were focused into some of these primary care practices to help bring some efficiencies and to drive outcomes. So we have something we have to measure, and that's something that we really haven't been able to do in the past. And a lot of the volume or a lot of the dollars that have been funded into healthcare before were based on volume. Now we're focused on outcomes.
That's really interesting. The metrics are starting to change, and I think that's where we can pick up on our next segment when we come back.
513-749-5500.
Very good. What's pound what? Pound
550
and 800-823-TALK.
There you go.
This is Think Talk Laugh on 55 KRC, the talk station. Welcome back to Think Talk Laugh here on 55 KRC, the talk station. We're here with Karen Mueller, Executive Vice President of HORAN Associates. First, I want to throw out props to our technical producer and board operator, Robin. She rocks. Just want to say that. You rock.
Thank you, Robin. We've got Karen here because PPACA.
Like alpaca.
Besides that she's given us a new acronym, PPACA, which is the Patient Protection Affordable Care Act. We can all now call it PPACA. She, as you know, Executive Vice President of HORAN Associates, I do want to say that they do health, wealth, and life management, but they're really involved with the community. They're not just out there to make money. And I was looking at some data about them, and they introduced data from the nation's largest healthcare plan survey, which is always helpful. HORAN was named Best Places to Work finalist 4th year in a row. And if you know how to have happy employees, then you're going to have happy customers. You will. And HORAN introduces healthcare reform impact analysis model tool. So I'll tell you, it's a pleasure to have them here on the show because we really believe in what they're doing besides the information they're giving us.
Absolutely. And our call-in number is 749-5500. Now, before the break, we were talking about
people are afraid to call. Go on.
Yeah. We were talking about different types of metrics. And Elsa, you and Karen had a nice conversation going there, and I had to interrupt. Feel free to continue.
I don't even remember what because we talked all during the break and we talked about so many other things. But one of the questions I had is, how does HORAN Associate work with some of these employers? Because, for example, the other day at one of my clients and they're a point of care company and they're interested in how all these changes, because there's a lot of move towards wellness and preventive care and things, were going to impact them. Is that something you work with some of these employers to understand? What are some of the services you guys offer?
Absolutely. I mean, health management is a huge initiative right now. And what we try to do with our employers is to try to get to some of the root causes. And data is our friend. And so if we can dig down and help identify what some of the specific drivers are that are causing the increases in the healthcare cost. I mean, the healthcare reform law, PPACA, as we so affectionately call it, is really it's more insurance reform than anything else. It doesn't really address health. So that's up to us. Some of these changes in the way that healthcare is delivered is going to be important. What we are focused on and what the healthcare system in general is focused on, at least here in Cincinnati, is trying to improve health.
But aren't there any incentives at all because of the act? Or
there are incentives. There are incentives back to the physicians to provide better outcomes. They get paid more, so better outcomes equal better incomes. And we're not quite there yet. And so don't misunderstand the fact that you're going to go into your doctor and you're going to see all of these changes tomorrow. It's not happening, but it is evolving, and that's very, very encouraging. People are in the, I mentioned the CPCI, which is, again, the Comprehensive Primary Care Initiative that's here in Cincinnati. I changed my primary care physician to go into one of these practices because I wanted to experience it myself and understand. And what I found was very interesting was that my doctor's asking me questions and encouraging me and really pushing me to get some of these screenings that I typically wouldn't have done. I probably would have ignored. Just getting my physical, making sure that I'm getting all my female exams, skin testing. I turned 50 a year or so ago, and so, there's some other really not so pleasant things that you have to deal with then. But they're encouraging and helping even set up those appointments to get me engaged.
But they don't get incentivized for that, but they get incentivized when you're healthier and their outcomes are better.
That's correct.
And how do they measure that?
Well, there's certain, again, not a simple answer. but there are very specific criteria that they are being measured on. So the focus on preventive health is really where the emphasis is as it relates to outcomes. The other place is, really focusing on the management of chronic conditions. And so when we talk about, mentioned the employers and how do we get to, help people manage chronic conditions, well, you got to get to the reason, forcing episodes of care. With the employers, you see a lot more employers that are providing health risk assessments, or HRAs, not to be confused with the health reimbursement. There's a lot of acronyms that are out there.
Right. Well, and there's a lot of HRAs from wellness companies and,
sure.
and different things like that.
But it's doing something with the data that you collect from that to try to encourage and incent people to do the right thing in terms of following up with their health care, getting the care that they need, taking the medications if that's what it takes to get that health, to get your health under control.
So are employers pushing this then, like behind the scenes, to try to get compliance, et cetera?
Pushing's probably not the right word.
Pulling.
It's caring.
Drawing.
It's all about they care.
Okay.
They really do need.
Well, it's a cost efficiency for them too,
it
because
is.
if they have healthy employees, they have employees that are showing up that are probably more productive. So, in fact, there's a lot of employers that offer these kind of incentives.
Okay,
just
let me
for
rephrase
them.
this. Is this something that employers are working on behind the scenes too?
And we are working with employers every day to help them improve the health of their employees. And so there are a lot of different strategies that we will use to get you there. So it really depends on
Could
where.
you name one or two? Just
yeah, it depends.
Is that tough?
Well, it depends on where that employer is on the kind of on that continuum of care. We have actually hired within HORAN a health management leader. Her name is Carol King, and not to be confused with the singer, although she will do that.
When I saw the notes, that did come to my mind.
So when we call, she'll sing to us the answers.
And she probably would if you ask her. She's very engaged. But part of what we have to do is we have to first assess where the employers and their employees are on that continuum for health improvement. Sometimes it's just putting in place some type of simple program that is getting people into a kind of some fun, engaging things, walking programs, Biggest Loser programs, are a couple of things maybe to start.
Do they work with those little meters too, like the
pedometers? That one right on right
Oh, she
now.
does.
Absolutely.
Oh, and by the way, we have a group in here they've got faces for TV, not for radio. We got a good-looking group in here today. Karen included.
One thing though that Viva mentioned earlier in the first segment, that when you were talking about chronic conditions, I just kept coming back to it. What about pre-existing conditions? How is that impacted now? Because Viva raised that in the first segment. I don't think we really got to it, and I think a lot of people want to know that.
Well, come 2014, January 2014, there will not be any type of pre-existing conditions. So people will be eligible for health insurance without having to answer health questions. And that's not always happened. And that was one of the reasons that the law was passed, really to address some of the gaps that were in the system.
Okay. So, but that's still going to be the case for insurances and other type of things, not for health insurance, though.
Specifically for health insurance.
Yeah. One of the things I was thinking about, Viva, and I think you might like this, is how it says patient protection and affordable care.
PPACA.
But nobody ever thinks of the patient protection part, and I know now why. It's because the law is 2,700 pages, and if you put it in front of you, it's like a life vest or some sort of bullet stopping.
An airbag.
Life vest. I like that. That was good.
And I think that is
Kevlar.
very good.
They're going for Kevlar.
You can't go through 2,700.
And now, Karen, because I keep wanting to stress Cincinnati. Is Cincinnati a regional model? Do you think it's different than national?
There are a lot of wonderful things that are happening here in our
besides
community.
Airbags and vests.
What is happening here is that we have a lot of very engaged healthcare professionals that are really trying to make a difference. They are very passionate.
From the doctors
to the hospitals, to the caregivers, to the community workers, community health workers. It's going to take a whole team to shift this model and focus on improving health and not just providing care. I've had the opportunity a couple of different times to speak at UC to the second-year medical students.
Really?
Yeah, and it's been a lot of fun. But one of the things that we're starting to see with this new group of physicians that are coming in is that they're not just learning how to focus on treating disease. They're really focused on learning how to treat the patient. And that's going to be the difference in our healthcare model.
That's a great point. And did it take PPACA to get folks
or were they already on their way there?
Or were they already on their way there? Do you think this was kind of helped jumpstart part of this?
It probably helped motivate things along a little bit, maybe to increase the pace.
Because I know it's always been, hey, it's about going to the doctor because you're sick, not about going to the doctor to keep you healthy.
But this is really interesting to me in terms of you spoke to these second-year medical students. So how many of them now, because of this or because some of these changes, are going to go into primary care versus, specialties? Is that a trend also? Are they getting incentivized in any way to do that?
There have been some initiatives right now to provide some incentives for more primary care. I think the most interesting thing was one of the students kind of looked at us and was like, well, how are we going to get this all done if the primary care is going to be so responsible for, outcomes and delivering better health and really being the one who's responsible for the care of these patients? And it was like, well, you're going to have help. So the delivery system model, even in the patient-centered medical homes, which is a new term that I'm using.
Patient-centered.
Patient-centered medical home. That's the key, is that it's really going to be focused on the patient, but getting to, better understand why people are not compliant with care. So it's not just going in and getting treated when you're sick, but it's that follow-up piece that's going to be so critical. So you're going to have people who are reaching out to help them understand, do you have, are you able to get to the doctor for a follow-up visit? Are you able to get your prescription? What are the underlying reasons why you may or may not be compliant?
Is Cincinnati going to be?
You got to hold that one. You got to hold that one.
Oh,
Sorry.
I can't.
Yes,
cut
you
you off.
can.
I saw that question coming, and I knew it was going to be a long one, so I had to cut you off on that one. Great conversation here. Big time. With Karen Mueller, HORAN Associates. You're listening to Think Talk Laugh on 55 KRC, the talk station. Welcome back to Think Talk Laugh on 55 KRC, the talk station. We're here with Karen Mueller, Executive Vice President, HORAN Associates, talking about PPACA.
What is
that? What is that?
You know something? I'm going to ask a question. Am I allowed to
Yes.
do that?
Yes.
Can a limit on page count ever be placed according to the PPACA to make it more palatable for the layman? Can they cut down the amount of stuff that's coming in?
I certainly hope so at some point.
You can't read 1,500 pages a day?
It just doesn't. Well, you know what the heck the trouble is, don't you?
It's per week
there are
now.
people sitting around somewhere whose job it is to write this stuff, and that's all they do. That's all they do is write it, and you have to eat it.
Well, we have more respect for what HORAN Associates does because it wasn't the initial 2,700 pages. It's the additional, if you're just tuning in, PPACA, which was Patient Protection Affordable Care Act. We're now calling it PPACA.
It still is, but
fine.
I don't think it changed.
We need something fun to call it, and HORAN has given us that.
Yeah. Well, I'm going to make up for the fact that when I came back from the third segment and Graham asked me what was the burning question I had at the end of the second segment, I couldn't remember because I keep speaking to Karen Mueller from HORAN Associates. She's the Executive Vice President. She's helping us understand PPACA. And I do remember what question I was going to ask at the end of the third segment, and it's really important because we've been talking about how HORAN is really involved in the community, and we are already in the Cincinnati area, tri-state area, a benchmark for health information exchange, and we have great medical centers and universities and a lot of there's a biotechnology hub growing here, especially in the mHealth and health IT sector with Innovate for Health and a whole bunch of other things. Do you think that we're also going to be a benchmark for some of this integrated delivery of healthcare and that you guys are working with?
Yeah, absolutely. I think that, the goal here is potentially for Cincinnati to be the model for the rest of the country.
Ha ha!
Yeah.
There we go.
Really,
Mark Twain was
wrong.
turning in his grave.
But part of that comes because we have a group of individuals in this community that are part of healthcare that are willing to work together. And they're not willing to share certainly all of their secrets, but you have great organizations like the Health Collaborative and the Health Council, and you talked about the information exchange through HealthBridge has been vitally important to really bringing this together. But you get a group of people who are willing to sit down and share information and try to figure out how to get it right. And we still have a long way to go, but there are a lot of things that I am seeing on a daily basis that tell me that they're working in the right direction. And for every community, things, healthcare is very regional. And so there's not just a simple answer for everyone, but I think we have enough models and enough brain power and passion here in our community that we're going to figure it out.
Yeah, Cincinnati's going to be known for good, especially after that whole IRS thing coming from the Cincinnati office.
Well, and that's true. But by the way, though, if you'd like to ask this brilliant Karen Mueller, correct?
Correct.
And she's
brilliant part, especially.
Well, and remember I said we've got like a group here with faces for TV, not radio. So brilliant and beautiful.
Say it.
If you ask about PPACA, what? 513-749-5500 or pound 55.
550.
Pound 550 if you're on the AT&T network, or 1-800-823-TALK. And we're talking about the Affordable Care Act, and just
somebody out there must have a question, because I know I do.
Well, I think they're scared. We talked about the fact that the bill itself was like 26 to 2,700 pages, and we are glad to have a guidance system of people like and HORAN Associates who get this additional 1,500 pages of updates per week, not per year.
Karen, just a question. If I, as a single person, have a problem, can I call your outfit to start
that's
having
a good question.
Help me?
We have been helping individuals and employers since 1948. We would welcome your calls.
I knew I'd heard about you someplace before.
And now, also, I forgot, the website, is that how people get in touch with you as well?
www.horanassoc.com.
So it's HORANASSOC.com. And do they just have a question they ask online?
They can go online to ask questions, and those will be delivered to the appropriate person who can respond to those. But we also have, feel free to call the office at 513-745-0707.
And then Elsa earlier mentioned that you have like tools on your site.
We do have some tools that are on our site. The PPACA analysis is something that's very customized to an employer, so that is not something that is on there. But there are some other tools that will help you in the area of health, wealth, and life.
Well, I'm just grateful to HORAN for giving us the PPACA, or we'd still be struggling with the,
When you guys actually said the website for HORAN together, you guys could be in synchronized talking events. That was awesome.
Really?
Well done.
And I only ever heard about synchronized swimming.
But that's the name that we have to remember, HORAN.
Yes.
HORAN. HORAN.
And if you can't get it, you see, I'm dumber than heck about these things. And if I had to find you, could I find you in the phone book?
You absolutely could.
Geez, I'm glad to hear that.
They still have phone books. So do you think that employers on the whole are really beginning to buy into the fact that this is something they need to do? Because I know originally people were sort of balking at it, saying they weren't going to do it.
It's here.
Okay.
And employers really are starting to recognize that they can't put off the inevitable. And so that they are asking for assistance and helping, and asking for our help to understand what the law is and really what the impact is to their business and to their employees.
Because very few people have groups with a team of people like you within their company that can analyze the initial 2,700 pages plus 1,500 pages a week.
And I will tell you, I take no credit for
there you go. She's humble too.
We have an incredible team of people who work very, very hard every day and who are extremely passionate about what they do, and they're really looking for solutions and are really willing to guide individuals and our business clients to figure out what the right answer is. And for every business and for every individual, that might be a little bit different.
Karen, when you work with employers and you look at different insurance plans and all that stuff, How is that affecting the number of insurers and how they work with you too in terms of connecting it to the employers? How does that work?
It's actually probably increasing the amount of options and potential solutions that are out there. So before you may have been limited to a number of insurance companies that you might go out to, and now we're looking at lots of options. Does it make sense to, as I mentioned earlier on, does it make sense to drop the insurance plan that you have and are offering to employees and send people to the exchange? Does it make sense to, go self-funded versus fully insured, where the employer is really taking on more of that risk instead of passing that on to the insurance carrier?
I would assume that's when you really want very healthy employees, and therefore you're willing to do some of these wellness and preventive care types things. So that
you're right on target.
Yeah.
Yeah.
Wow. And are a lot of employers going that route?
A lot of employers are considering that. So again, everything is about analysis. So the more information that you have to make decisions, the better off you're going to be. So we try to dig down as deeply as we can and weigh out what the best solution is for a particular client.
So for some of those situations, are they actually can they even incentivize economically the employees to be healthier? Because it saves them money?
There is some of that going on. As a matter of fact, we do a little bit of that at HORAN. We started off very slow.
Because you look very fit and healthy, so
know,
you must be racking in the dough from that.
Well, I don't know. Let's put it this way: I'm not paying more for my health insurance as a result of it. So, we have phased in. As Viva mentioned, we were the healthiest employer this year in 2013 as well as 2012. And it's
what does that mean? They check your employees, and you guys are like better than everybody else, healthier.
Well, we have a lot of the right initiatives. We have a lot of the right initiatives. So, but there is so much of it that we have done at HORAN, and it started very slowly and trying to get employees engaged. And the employee engagement piece is really what makes the difference.
And remember, this is a group that doesn't just say they're doing things, they do what they say they're doing. So I really like that.
We better practice what we preach.
It's been real nice meeting you, Karen. It really has, because I wish you could see your smile. It just lights up the room.
It does. And, I love that your group is doing what they're trying to suggest other people do, and that there's monitoring in place. What, Elsa?
But I do see her swiveling in the chair because I think she's trying to trick her pedometer for some of that extra HORAN cash. I'm pretty sure of it. She keeps moving around. Yeah, it's all. Yep, I see your little tricks now.
I didn't know you could trick pedometers.
Yeah, you can trick anything. Come on.
Oh, you're right. You just tricked me.
Well, it's something you got to have a gift for. You got to have a gift for. Folks, we appreciate you joining us. You've been listening to Karen Mueller, Executive Vice President at the HORAN Associates, talking about PPACA, a new acronym that I just learned myself. We're here to help you guys. We're here every Sunday from 2 to 3 talking about healthcare and helping you navigate that world that is healthcare here on Think, Talk, Laugh. That's what we do on 55 KRC.
And we do it in a
station.
We do it in a multi-generational way, don't we?
Absolutely. Absolutely. Thanks again, folks. Take care.
Opinions expressed on Think, Talk, Laugh are for entertainment, informational, or educational purposes